Okay, so we have here the ABO discrepancy. So AB discrepancy could be identified here by having a weak reactions. Most likely, we are expecting the reaction here to be 3 plus or 4 plus with your agglutination reactions. But if the reaction here is mga 1 plus, 2 plus, it might suspect here for the presence of your ABO discrepancy. So we have here the different ABO discrepancies. The group 1, on the other hand, the group 1 is characterized here by the missing or weak reaction in your antibody production. And it could be detected here through your reverse typing, because remember that your reverse typing, you're detecting for the antibodies. And most likely that's where the error or discrepancy could be identified with the problem in your reverse typing, but not in a forward typing. Because remember, group 1 would be problem with that related here with our antibody productions. So we have here the different conditions also here to your group 1 discrepancy or in our antibody production. So the first one, old age patient or even newborns. Remember here that at birth, we are the baby or even the old age population here that in the case of the baby, they are not yet producing their own antibody. So they started to produce also only antibody here on the third or the 3 to 6 months of their lives. And at the same time for adult population, as they try to grow older, our antibody titer try to decline. It might result here to the weaker reactions and result to discrepancy. Another one, patients with a hypogammaglobulinemia would also have here a weaker antibody productions or immunodeficiency in patients. Leukemia like your chronic myelogenous leukemia, and we have also here your lymphoma. To enhance the reaction of our antibodies, so since remember here that your AB antibody is an IgM antibody, is a cold reacting antibody, then you just need to incubate your reaction here, enhance the reaction by incubating that one at room temperature for 15 to 30 minutes. Or you could also have a lower temperature, 4 degrees for 15 minutes. That would enhance here the reactivity of our ABO antibodies, which are IgM antibodies, which are cold reacting antibodies. Okay, the group 2 discrepancy, on the other hand, is characterized here by our missing or weak antigen production, and that would be identified here as our problem in our forward typing or our front typing. Remember that your forward typing, it try to detect the antigens. So here, okay, the error could be identified here through your forward typing or your front typing. Okay, so group 2 discrepancy could be related here to number 1, the presence of your subgroups that would have a weaker actions, subgroups for the A and beta subgroups. Another one, we have your leukemia, Hodgkin lymphoma, and we have also here your acquired B phenomenon. Acquired B phenomenon here, condition wherein the patients would have intestinal obstruction or problem in the intestinal tract that would allow the blood vessels here, the patients, to be exposed to the B-like substance, which eventually exposure here to the bacteria like your E. coli, which try to acetylates your immunodominant sugar of your group A individual. Acquired B phenomenon occurring here on the type A individual, where eventually the bacteria, because of intestinal obstructions, because of colon cancer, so that would expose here the blood vessels of the patients, and therefore the bacteria try to acetylase the immunodominant sugar group A, which is your N-acetyl-galactosamine, acetylate that one to become your D-galactose. And producing here para siyang nagiging type B ang individual natin. Okay, to resolve here problem related to acquired B, so just in here is number 1, you can use a monoclonal anti-B, anti-sera, which is your ES4 clone. This one is more magpa-positive siya pag acquired B phenomenon ng patient. On the other hand, you could also use anti-sera here, which has been modified the pH of more than 8.5 or the pH of less than 6 na anti-sera natin, anti-B, would only be reactive with the true type O or true type A na individual but not in your acquired B phenomenon. Third one, you could also acetylate here your anti-B, anti-sera by adding that one with your, or acidified, no acetylates, but acidified your anti-sera here by addition of your 1N hydrochloric acid. That one will be reactive only if the patient is true type A, but not in your acquired B phenomenon. Magne-negative ang pasyente natin for that. Okay, then we have here your group 3 discrepancy. Group 3 discrepancy characterized by an increased plasma proteins. Then in case of your multiple myeloma and even in your Waldenstrom macroglobulinemia. Or even increased plasma volume expander like your dextran, polyvinyl pyrrolidone, or contamination of the Wharton's jelly. So most likely increased plasma protein would try to have here rouleau formation. So you could perform here saline replacement. So i-wash natin siya ng saline. So if you are having the washing step naman, diba? So you could have your washing step 3 times. It could disperse here your rouleau formation related to your increased plasma proteins. So after saline washing, you perform again here the tests. Okay, the blood typing. So pag nawala siya, so that's maybe related here to your increased plasma proteins, your group 3. Group 4, on the other hand, due to your miscellaneous, related here to number 1, presence of your autoreactive cells. So that's your autoantibody that could be resolved here by doing your autocontrol. So for the autocontrol, sa patient serum, i-add mo na kanyang patient red cell. Kung magkaroon ng agglutination reaction, so may autoreactive cells. That's autoimmune disorders. Another one, we have here patients circulating blood. Circulation here would have more than one red cell population because of the recent blood transfusion or even stem cell transplantation. The presence of your ABO isoagglutinins, and we have also your presence of your ABO allo antibodies. All of that one is also here to your type 4 discrepancy. Okay, we have your example of your ABO discrepancy. So, for example, we have your anti-A, anti-B. These are your forward typing. A1 cells, B cells, this is your reverse typing. This is your autocontrol. So, like for example, if all the results here are all negative, so wala siyang blood type. So, that will signify here that our patients might be group O, pero ano ito, pwede siya newborn, ay pwede din siyang old age. So, that belongs to your group 1 discrepancy. Another one, we have your anti-A1, anti-A, so this is your, diba, this is again your forward typing. Okay, so lahat ay positive, that will signify rouleau formation. So again, pag rouleau formation, ang ating resolution ay saline washing para ma-disperse ang rouleau formation. Ito naman, you could enhance agglutination reaction if there will be problem with antibody production by incubating that one at room temperature for 15 to 30 minutes, or you could have your 4 degrees Celsius for 15 minutes to enhance your antibody productions. Next, we have your A2 with anti-A1. So, forward typing, signifying this one is A, type A, kasi positive siya dito sa ating anti-A. Kasi may A antigen, okay, ang presence sa kanya. And notice here sa kanyang forward reverse typing, dapat pag type A ka, okay, this will give a positive result here for your B cells here because this will detect sa anti-B antibody. But notice here, positive result sa A1 cells, which is unusual for type A, di ba? Your type A will have A antigen and anti-B antibody. So, meron siyang A1 cells na positive, mean to say may anti-A1 siya. So, that's your A2 na individual. Okay, since meron siyang anti-A1. Pag A1 siya, di ba, wala kang anti-A1 kasi may A1 antigen ka. Next, we have here acquired B phenomenon. So, we have here the forward typing, 4 plus, saka 2 plus anti-B. Okay, so, pag acquired B, original na blood type ni patient type A, dapat dito ka lang mag-positive. Dito, medyo nag-positive siya sa anti-B, mean to say parang may B-like substance siya because it tried to acquire that one by your bacterial contamination, bacterial infections. Okay, and B cells is signifying na may anti-B antibody siya. So, that's your type A na may anti-B antibody. Only that, nagkaroon ng discrepancy dito, that's your acquired B phenomenon. So, gagamit ka ng monoclonal PS4 clone na that will give a positive result only for your acquired B. Pag nag-negative siya, so, hindi siya acquired B. Ito naman, notice here lahat, pag autoreactive, you try to check for the autocontrol. Sarili niyang serum, gagamitin mo, i-add mo na kanyang sariling red cell. Pag nag-positive siya, that's autoreactive. May autoantibody ang patient na. Okay, then we have here, paano malaman kung anong blood type ni patients? Again, the true reaction, always 3 plus or 4 plus ang reaction natin dapat. So this is your forward typing, you're detecting for antigen. This one is reverse typing, you're detecting for antibody. Itong mga reagent natin. Anti-A, anti-B for the forward, reverse is A cells and B cells here. Notice here for this one, so pipiliin mo lang 3 plus saka 4 plus. Never mind the other na reaction. So notice here, ito yung positive natin, 3 plus 4 plus. So this will signify the patient's type AB. Ito naman pipiliin natin kung saan siya ang may 3 plus 4 plus, so ito siya. So this will signify that the patient is type A, pero may anti-B, antibody ang patient natin. So type A ang patient. Ito naman, okay, so okay pala ito. This is your type O na individual. Basta ginanapin mo lang kung saan 3 plus saka 4 plus. Okay, that would identify here the correct blood type of the patient. Okay, another example, we have this one. So, 3 plus 4 plus, 4 plus ito 4 plus. So, ito hanapin mo dalawa. So, that's your AB, ang ating patients. Okay, so, thank you.